Hey, it's Chris Beyer.
Chris Bowling.
Brad Johnson here.
Hi, Brad.
Happy Bottom Line Thursday, 1st of December, 2024. Let's talk about some stats that you found, Brad. You like to find these numbers and walk through them every year, but I think we've touched on this before. I'll let you run in.
Yeah, another annual study I like to take a look at. So they take a look at, well, it's not even a study, it's just the actual renewals that the federal employee health plan is giving out. Yeah, I think there's maybe the fallacy that, the federal plans, which are very generous, no
Yes.
question, they're very solid plans, and there's a multitude of carriers with them, but there's maybe the line of thinking that those employees aren't seeing much in the way of rate increases.
Yeah.
It's actually not quite too true. Now, granted, the starting point is potentially lower than maybe a private employer, but they're seeing an average of a 13.5% rate increase
Wow.
in their contributions. The employees, federal workers, 13.5%. Post office thing is going up 11%. They're run a little different, same overall platform from what I understand, but a slightly different
Wow.
cost sharing structure.
That's horrible.
It's a lot. Yeah, that's more than you'd expect for one of the
Absolutely
largest plans, for sure.
Yeah, so I mean that comes back to what we've said before, that the large groups are still being impacted just like the small groups or the independent carriers. I think costs are continuing to rise. It's not uncommon, but that is a surprising number, especially if you think of what you would consider to be rich federal benefits. They shouldn't go up that high, but yeah, it's happening everywhere.
Yeah, and the study then, what's interesting, it says the employee portion, it talked about the government share was going up 10%. And so quick math, let's think about it. The employees going up 13.5. It sounds like a catch-up year, perhaps.
Yeah.
Charge the employee more than before. The government is still taking a double digit. They went on to cite the normal culprit, right? Rising drug costs, behavioral health spending, just rising costs in general. But I dove into the details, and this may be a reason for it. A lot of the plans now are going to be required to cover in vitro fertilization up to $25,000. And we all know that that's a very important benefit to those people that can't have kids, but there's also the costs associated with it. And also many will have to cover the anti-obesity GLP-1s. And so that was in the details. So I'm sure that fed into it. Whenever I've looked, that usually increases cost 2 to 5%.
Yes.
Anyhow, but bottom line, government employees aren't immune from it. The government's not immune from it. It's all around.
You can have it all, but somebody's got to pay for it, right?
This is true. This is true.
You can add whatever you want, but it's
I think as we came out of renewal decisions for 1/1, we had a lot of clients that were projecting a decrease in their budget, which was awesome to see. But again, they're being very creative with what they're spending dollars on. But even those that had the decrease, they held employee costs flat or raised them a couple of percent just so that you don't have multiple years of no increase. But that's scary to see that trend on a national level. We might be more insulated with a few of our self-funded clients being more localized and more creative. But man, that does not bode well for the future years coming up.
Yeah. Yep. Trend gets all of us. That's for sure.
That is true.
Yeah. Well, one of our local Blue Crosses, their trend started at what, Chris? 10.3?
Yep.
It was on every single renewal. Trend 10.3. So you're out of the gate at 10% increase, and then you get adjustments for risk and demographics. And I talked to UHC, and they said they're right around the same, 10.5, 10.8, depends on where it is in the country. So, I mean, we talk about this a lot. We cannot continue down this path. No one can take 10% increases every year.
No,
it's
not feasible.
Sustainable.
Yeah, your pay will just become your benefits.
Oh,
that's it.
Yeah, unfortunately, yes.
Great topic, Brad. Thanks again for sharing this month. We look forward to December's edition when it comes out.
Yeah, sounds good.
Thanks, guys.
Thank you.
All right. Thanks, guys.
All right. Bye-bye.